We now have the pleasure of having another wonderful, and I'm sure will be very interesting presentation led by Dr. McGeaney, who you all know from Boston Medical Center. And we have the privilege, really, and the pleasure and the honor of having three folks that are unfortunate sufferers from this condition. And Brian and they will take us through their struggles, problems, wants, and needs, and hopefully shed some light on how we can maybe do a better job in our own day-to-day patient care. So, Dr. McGeaney.
One of my goals is not necessarily for you to learn just more about cluster headache, but the life and their interactions and experiences with the medical community. What they do say among themselves, what they say about us, their overall experience with the medical community, because you don't really get that so much in clinical practice. I'm particularly honored to have such experienced patients and advocates with me today. It really is a pleasure. And I'm just going to introduce them briefly, and then then they will tell you a little bit about themselves, and I do hope to make this more interactive. I don't know if we have a roving mic. If not, I'll go with my lapel mic. We have a roving mic. Wonderful. And I think that the sort of things you're going to hear about, including the sort of, I'm going to tell you firstly about Ashley on the left. And Ashley has had episodic cluster since childhood, which she'll tell. She's a freelance medical writer. Let me tell you something that she may not tell you, and that in September she published a book for cluster patients. It is a fantastic book, and it is a must for all patients. And I'm not really here to sell anything, but this is a medical education for patients. And there is no other one, and it just happens to be very good and available on Amazon. And that was a wonderful contribution. She also runs a monthly Twitter discussion on cluster. The next one's coming up in a week or so. Maybe you could share that with us when you get a chance to talk. And that has got some attention. Her husband is to her right, and Andrew works in the financial world. And I think we're particularly interested in hearing about Andrew's experiences as a child, because as a child he developed chronic cluster, and of course it took forever to make the diagnosis, and it just sounds horrific what he went through. To this day he has chronic cluster, and I'm delighted that he can manage to come along today with us. And finally, the gentleman who needs a little introduction among the cluster community, Bob Wald, who I mentioned earlier, founded a patient advocacy organization, which is a very successful one, by the way, founded in 2001 or thereabouts, for education advocacy, and they are incredibly well represented at Headache on the Hill, for instance, proportionally much more so than any other headache disorder, and which is wonderful, but they have a number of different pursuits. Bob, as you will hear, there's only one person in this room who gets enormous amounts of calls from cluster all the time, and that's Bob Wald. And he has spoken to more cluster people than anybody else in this room, period. More than that, there are calls in extremis, which he will mention, and the sort of things you couldn't make up, and what to do next. And without further ado, I want to pass the mic over to each one individually, just to expand on their experiences. And I will, take liberty to maybe bring up topics or ask them to expand on topics. And I will be taking comments from the floor. But firstly, Ashley.
Hi. Thank you for giving us the opportunity to speak and share the patient perspective. I'm Ashley Hattle. I started getting episodic cluster headaches in 2007. I was textbook from the beginning, getting 2-week episodic cycles every 6 months. The first attack I chalked up to dehydration because I was a lifeguard in high school, but they came back every day at the same time. My father took me to a neurologist who said I had cluster headaches, gave me a prednisone burst, and sent me on my way to college from Nebraska to Colorado. I thought he had cured the headaches, as he didn't explain that they would come back and I would need treatment for the rest of my life. So when they did come back 6 months later in college, I didn't know what to do. I had my roommate take me to the emergency room. I was crying, cradling my head, and pacing in the waiting room. I told them I had cluster headaches, but I distinctly remember the physician and nurses telling me they were migraines. They gave me IV fluids and a prescription for hydrocodone, which we all know does nothing for cluster headaches. The next day, I was back in the ER telling them the narcotic didn't work. They treated me like a drug seeker, and I understood never to come back. I then went to see a primary care physician at the University of Colorado who said she would only prescribe oral sumatriptan, and if that didn't work, we would try the nasal. But then the cycle ended. Still not understanding my condition, I continued college life thinking, thank God they're gone for good. Then the next cycle, I went to urgent care, begging for sumatriptan injections, knowing I needed something fast-acting. Luckily, the urgent care doctor understood the necessity and thus began a several-year streak where I would use 2 injections per day for 2 weeks at a time, and then it would end. In 2012, I had a 35-day cycle in the spring and a 46-day cycle in the fall. I found myself begging my new primary care physician, who was the 5th I'd seen at the time, for help when insurance wouldn't cover any more injections. In the span of 35 days, I spent $900 on sumatriptan because it was my only option. That doctor was the first doctor who gave me hope. He realized he didn't know how to treat me, so he did his research, prescribed me oxygen, albeit he gave me a 5-liter per minute prescription with an oxygen concentrator, and referred me to a neurologist in Michigan. By the time I got to the Michigan Head Pain and Neurological Institute in 2014, I was fed up with physicians and friends who didn't understand what I went through every 6 months. I came prepared with a long list of questions, my full headache diary, and my diagnosis was confirmed. Dr. Arnaldo da Silva knew I needed high-flow oxygen at 12 to 15 liters per minute, and I now use 25 liters per minute, and referred me to Dr. Judy Lane in Denver. However, in the 2 hours of testing before I saw Dr. da Silva, 3 nurses told me I had migraines. I kept telling them when I'm in a cluster, when I'm having headaches, and they still believed that they were migraines because women don't have cluster headaches. This drawn-out process taught me that I was the only person who could help me. I had to fight so many doctors and nurses when I already had an official diagnosis. I was kicked out of the University of Colorado Hospital when I missed 2 appointments because I was having an attack and couldn't drive myself there. I was lucky to have supportive friends who would talk with the pharmacist when I couldn't. I have a father who helped me pay out of pocket when insurance failed me. In 2014, I bought several books from Amazon about cluster headaches, just to find that 2 only mentioned clusters in 1 paragraph or just 1 sentence, and another was haphazardly thrown together, offering only more confusion. That's when I decided to write the textbook that I needed when I was diagnosed. I found out about cluster busters and went to the 9th conference in Nashville, where I met Dr. McGeaney, Bob Wald, and my husband, Andrew Cleminshaw. For the first time, my pain was validated, and I heard heartbreaking stories that were too similar to mine. Men and women who were misdiagnosed with migraines for years, patients who were given the wrong oxygen prescription and denied fast-acting medications. This group of people, led by Bob, had found each other all because the healthcare industry failed them. You see, cluster headache patients will never stop searching for relief. They will only look elsewhere when a physician doesn't know how to treat them. I spent the next 3 years interviewing patients, their family members, and neurologists. I poured through research studies in the hope to understand cluster headaches more and provide a research for others like me who had been let down by the medical community. I'm proud to say that I accomplished that, but I look back and I wish it would have never been necessary.